Hi, everyone. Welcome. Thanks for being here today. This is our Veteran Oral Health virtual road tour stop in the state of Pennsylvania. Next slide, please. We are going to start with an introduction, a national overview of veteran oral health. We will then move on to veteran oral health in Pennsylvania and follow that up with a discussion. At this point, we really want to hear from you all. A big part of what we're doing today is sharing resources, and another big part is hearing from you. We want to know if we're missing any big pieces in your state, and we want to use this feedback for future research and learning opportunities. So please do feel free to come on camera and share in the chat if that's more comfortable. But yeah, we are expecting to hear from you today. And then we will end with some action items and next steps to veteran oral health. A few housekeeping pieces. We are recording the session and we'll have the recording available afterwards on our website along with the slides and other materials. Please chat and engage throughout. And please also take a moment to share your email and organization in the chat at this time. And if you have any questions throughout, please also feel free to stick them in the chat and we will respond as soon as possible. Next slide. These are our learning objectives today. These were provided in the registration information and are attached. Our presenters do not have any disclosures to share today. And with us today is Liz Flannery, our Executive Director of Education and Leadership here at AIDPH. Myself, Sam Lisette, the Community Education and Outreach Coordinator. And the person that we will thank today for bringing us all together is Leah Beniche, and I'm sorry if I butchered your last name. She is the Program and Evaluation Coordinator for the Pennsylvania Coalition for Oral Health. So thank you for your dedication to veteran oral health. Alrighty, and before I hand it off to Liz, I'd like to start with a poll question for you to answer. I'd like to hear what you think are the priority areas for veteran oral health in your state. So I will go ahead and launch that now and give you an opportunity to respond. Okay. And without further ado, I will hand it off to Liz.
Thank you, Sam, and thank you everyone for being here. Another thank you to Leah. What we hear is that there's a really strong interest to learn more about veteran oral health in Pennsylvania and solutions forward to advancing veteran oral health in Pennsylvania. So thank you again, everyone, for being here. I will be presenting information from the work we've done and the data we have on veteran oral health, and we also have set times of built-in questions, comments for the chat, but we want to hear from you. We want this to be interactive. So if we're not asking a question, but a question pops up for you or you have a comment, please raise your hand or share that in the chat. We want this to be as interactive as possible. So as we're getting started here, I'll just take a quick look. Sam, do you want to chime in with what we're seeing on this poll before we fully dive in?
Sure, I'll go ahead and share the results. It looks like 80% answered access to care, and 40% oral health literacy, 10% workforce development, policy advocacy, and 30% with integration with general health care.
Okay, great. That's wonderful to know. I think we're going to touch on all of those pieces and particularly around that access piece and the integration piece. So that's seems well aligned to what we'll be covering today. We can go ahead and go to the next slide. We're just going to start off with a little bit of information about AIDPH and why we're doing this work and in this space. Our mission is to empower our community to advance oral health through science, education, and advocacy. And the program we're doing here today is really the intersection of those three pieces. We're taking the data that our research and impact team has done, putting it together in this educational programming and talking about potential advocacy pieces we can do with that information. Our goal is always to have our data and information, our education packaged in easily usable ways. That's what we're going to go through the state profile in Pennsylvania, so that you folks on the ground who are doing different programming, potentially policy advocacy, other pieces to advance veteran oral health, have tools that are really easily usable. And we're doing this work because we're working towards our vision of a justice-oriented oral health system. We can go to our next slide. We have 4 communities of focus at AIDPH, which include veterans, folks living in rural communities, LGBTQIA+ people, and people with disabilities. And of course, recognize that there's also intersectionality amongst these 4 communities, particularly when we're talking about veterans. There's a fair amount of intersection with veterans and rurality and veterans with disabilities, and we'll talk about that more in just a little bit. You can go to the next slide. So we want to take a moment and thank our funder for this program, which is CareQuest Institute of Oral Health. They're a longtime partner. We can go to the next slide and I'll talk about that a little bit more. So we've been working in partnership with CareQuest since 2021. We've been working on collecting data, publishing data, and producing resources for organizations like Pennsylvania Coalition of Oral Health, like yourself, and other states to be able to leverage the work that they're already doing into more success and create a more evidence-based framework for the work that we're all doing collectively to advance veteran oral health. So to that point of what I said earlier of we're always looking to take the data and research that we're doing and really publish that into really usable tools. So we're sharing that out today, and also want to hear upgrades, what other resources are helpful, etc., with the information we have. We can go to the next slide. So we're going to start with a look at veteran oral health, an overview at the national level. We're starting with a national overview, which might be a review for some of the folks here on this call, but doing this work and talking to many states over the course of this year that we've been doing this virtual road tour, really what we find is that there really isn't an understanding of how medical and dental benefits work for veterans, how they work, and also how many folks have access to that. And frankly, we include veterans in that group of folks that may not quite understand it. Many veterans don't understand the eligibility process. It can be really complicated, and what's available to them through the VA. So we like to start at this national level in that basic eligibility access point to really give an understanding of the current available benefits to veterans through the VA. And when we say benefits, what we mean is what care you can get, how much it costs, and where folks are able to receive that care. And that's determined by Congress. It's ruled through Title 38, where eligibility for medical, dental, and other primary care benefits are all determined through federal code. So that means it can only be changed with a vote through Congress. So if we wanted to change the system, it would have to change on that national federal code level. And we also like to note that if a change was made there, along with a vote to change the access eligibility, there would also have to be funding in place to be able to expand those access to benefits. So all that to say is a change to the federal healthcare system as it relates to VA dental care would require federal legislative action. We can go to the next slide. So what does it look like? How many people are eligible? So currently, long story short, most veterans are not eligible for dental care through the VA. So if you look at this graphic here and you look at the top row of people, it represents all 20 million veterans that are currently living in the US. And the lightest half of them are the half that receives care outside of the VA or are otherwise ineligible for care through the VA. And as you move over to the left and those people get darker, we're seeing that those are representing the about 10 million people who are getting care in the VA. And of that 9 to 10 million veterans, just that tiny, tiny little darker blue and red areas represent the number of veterans who are eligible for dental care. So that translates to the fact that veterans are walking into VA healthcare appointments, maybe to get their medical care or their general care, primary healthcare needs, and they're walking out with dental pain or other dental issues that they cannot receive treatment for, and they're not being seen for because they're just not eligible. So this number is about 1.8 million are eligible for dental care. But then of that 1.8 million, we see only about a third of them are actually receiving the care and utilizing that piece. And the answer to why that utilization rate is so low, we don't know the exact answer, We need more data there. We can make some guesses, some informed guesses about why that's happening. Again, the understanding of benefits when you're looking at rurality and the locations of VA healthcare centers, that transportation and access can be a piece. They might have eligibility, but they might not be able to get to the appointments, as well as some other pieces. So this is where we're looking nationally. We can head on to the next slide. And we also want to take a look at chronic diseases in veterans. Veterans in particular with heart disease and diabetes experience a higher rate of dental issues. And unfortunately, what we also see is that veterans with those high risk, high cost conditions are more likely to lose all of their natural teeth, even if they're experiencing dental visits within the past year. So, what that means is that even among veterans who are accessing dental care and are able to visit the dentist, they're still receiving worse oral health outcomes. And that's because those chronic disease conditions aren't really managed in an integrated care setting. We know that the VA is the largest integrated healthcare system in the nation, and they're therefore best positioned to meet the chronic disease conditions and then therefore the complex medical needs of veterans. But unfortunately, per the eligibility piece, most veterans aren't eligible for that comprehensive full dental care through the VA. So we can go to the next slide. We'll look at these chronic disease conditions in a little bit more detail. And the information that we're pulling here is from some of our most recent research that we did, again, in partnership with CareQuest. And we're honing in on these chronic disease conditions because even after controlling for factors like income, education, and rurality, we see that veterans with diabetes are 40% more likely to be edentulous than veterans without diabetes. So it really highlights that intersection of chronic disease and oral health outcomes. And when we go to the next slide, we'll take a similar look at heart disease and see it's very similar, that veterans with heart disease are about 30% more likely to be edentulous than veterans without heart disease. So this just really highlights kind of that intersection of the chronic disease piece and underscores why it's so important to have integrated care options. We can go to the next slide. The other piece of this, when we're looking at that at the legislative and policy level, we see a cost savings as well. So there's a couple of things going on here. We're seeing really poor systematic health issues, really poor oral health outcomes, and then also it's very costly from a healthcare management perspective. And this is something that folks can highlight when you're working with those decision makers and pull out this cost savings piece. So again, looking at some of the most recent research that we have done with CareQuest, we see that for every dollar invested in dental care for veterans, $1 is saved in diabetes care management, and $2 are saved in heart disease management. So when you're looking at those numbers, you're really seeing that the cost in preventive oral health care is really paying for itself, if not resulting in an overall savings. Again, these are national numbers, but just really put into perspective kind of that overall systematic healthcare system environment of what it could mean to have better oral health access for veterans. We can go to the next slide. So I just want to highlight here again, I noted that I was pulling this from some of our most recent research with CareQuest. I just want to highlight that these are all publicly available reports and resources that are available on our website. We'll put that in the link. They're available at the website we have in partnership with CareQuest, which is vetdentaldata.org. You can also find links to them on AIDPH.org. And this is just a variety of some of the research and resources that we've pulled together. Again, for organization like yours, our goal here is to make sure that folks on the ground doing the work at the local level in veteran oral health understand and know that we have these resources and are able to use them and that they're accessible and easy to use. So please take a look. We shared the link. If you ever have any feedback or questions, we're happy to chat about them. And just let us know how we can upgrade and how those can be useful. We can go ahead here and move on to Pennsylvania. So our state profiles, what do the state profiles really look like? We're really why you're all here to hear about Pennsylvania and what's going on in your state. Um, Again, at that Vent Dental Data, if you haven't already pulled up your state profile, Sam just shared the link directly to your state profile, and you can pull it up and go along with us. And a little bit about why we've pulled together these state profiles. So what we've heard, again, doing work in veteran oral health, what we were hearing over and over again was, well, this is the national level. What do things look like in our state? What's going on in my state? Do you have information on the local level? So we were really hearing that community need for a more honed in state-based environmental scan. And so that's why we put together these state profiles. The data is fairly limited, but this was a way that we could pull everything that was available together, do an analysis, and make it all as easily accessible in one spot as possible. The hope was to make it tangible, digestible for a variety of stakeholders, and easy to understand and apply, again, for folks who are maybe taking them to decision makers or policymakers who aren't necessarily folks who work in data. These were written and published in a way that they can be for the layperson and not necessarily a data analysis. We can go ahead and go to the next slide. Okay, great. So I'm going to dive in now to a little bit more detail of what the sections on these state profiles are, kind of why we put together the information and how you can use them. So at the very top of the profiles is a little bit of context around what's going on in your state and also the national coverage of dental care through the VA. Again, we'll put that at the top of our work because, again, most people don't really understand that veterans aren't eligible for dental care through the VA. So if you're taking this to a policymaker, a decision maker, a grantor, a funder, the first thing that you can start with is letting folks know that veterans aren't getting care through the VA. And that's why it's important in the state of Pennsylvania, because ultimately the states and other healthcare systems then bear the disease burden and the access burden, the care delivery burden, because of the lack of eligibility and coverage at the federal level. So we also went through and highlighted where veterans are positioned in your state. So if we take a look at Pennsylvania and see where, we included a lot of information about what you can find on rural veterans, because we know veterans are disproportionately located in rural areas. So taking a look across the bottom there, we see that 7.4% of the state population, which is about 770,000 people in Pennsylvania, are veterans. And of that group, 5.6% of them are living in rural counties, with Warren and Tioga, I hope that's correct. If it's not, y'all can let me know in the chat. And Wayne counties are the counties that have the highest veteran population. So that can really give you an understanding based on the work that you do, where you're located, what you're seeing, of where your population lies and where program and resources are most needed when we're looking at this information. Knowing that veterans are often concentrated in those rural areas, it's important context for state-based stakeholders to make informed decisions about those care delivery paths. So then we take a look at this, and we're pulling out some state-specific insights here and looking at Pennsylvania versus a national comparison. And this is important because sometimes when you're presenting information, if we were only looking at Pennsylvania, that wouldn't give us, we would have no context to understand what those numbers meant. So putting them in comparison with that national data really gives the context of, is this good, is this bad, kind of where do we stand comparatively. So if you look across the bottom there, I just want to highlight that the numbers there, 1 would be the worst and 50 would be the best. So when we're looking, we're pretty low ranking on indenturism, heart disease, diabetes, pretty good on the uninsured piece. So we see the percentages all the way over to the left. And again, this gives a direct comparison nationally, but the other thing that folks can do, we have a state profile for every single state. So you can pull your state up along with any other state. So if there's states that you know might have similar demographics, similar systems, similar legislative processes, you can pull those up and see where they are in comparison as well to the national data and really give yourself a good environmental scan, good contextual information there. So we can go to the next slide. Okay. And taking a look at this, So we pulled all of the information, and our idea was to put it together as a report card. And again, to the point of trying to make the data and information as digestible as possible and really accessible. Excuse me. The idea there was really that everyone knows what a report card is, right? We understand, most of us have gone through life receiving report cards. It's an easily understandable system. So we kind of pulled those different data points, looked at them, gave individual grades, and then pulled them into overall grades. And the piece that I want to highlight here is that it's important to look at those poor grades and understand where improvement is needed, but it's also really important to look where you're doing well and kind of talk through and understand the pathways of how you got to those numbers. Where are those success points and what strategies were successful in getting there? What made that piece successful, and maybe there's some transferable strategies there that can be replicated when you're looking at those areas for improvement with the lower grades. So we can go to the next slide. Okay, so we want to pause for a minute. Again, we said we want to hear from you, and we will have a full discussion at the end in just a bit. But I would love if folks would put in the chat if they're surprised about the state profile and grading, as well as are there any data gaps that you think should be explored in Pennsylvania? Again, we want to hear how these resources work for all of you, and if there's pieces that you're seeing that aren't reflected here, we would love to know that. So please share, please type out and share. If there's also something folks want to go into more detail, we would love for you to come off mute and share that as well. And as you're thinking through that and getting ready to put your answer in, we can head to the next slide and chat a little bit more. Yes, that's a really good point, Annalise. Thank you. Annalise is asking also specifically why insurance coverage may not be translating to outcomes like indentulism and diabetes. So we see a better score there, a better rate, another piece. But if that's not translating to affecting those oral health outcomes, if folks have ideas on why that is or what's going on there. Okay. So as we are thinking through and popping in the chat, I'm just going to talk a little bit about using these state profiles. And I apologize for the graphics down here. Sometimes we get a little wonky in translation, but how you can use the state profile. We talked about advocacy and policy, clinical changes that improve access. I just want to note there, I think we've noted a few times taking this to decision makers, policymakers, and that really implies work on that legislative level. But when we're talking about advocacy, we also have that small p advocacy piece, which can be as simple as educating clinics, talking to folks about changing their forms. I know Sam can speak to that a bit of kind of making sure that we have proper intake information and are asking veteran status on our intake forms. That's something that we find is not often being done. It's a data collection point, and it also gives those providers really important and relevant information as they're going through their care piece. So when we say veteran advocacy and taking this report and information to those decision makers, we really mean that across the board from the lowest to the highest level. Educating stakeholders. So again, we kind of started off the top. Something we see here is folks don't really have an understanding of where and how veterans are getting their oral health care or what their eligibility is to the VA. We find anecdotally that a lot of folks just assume that veterans are taken care of across the board 100% at the VA for all needs. And we know that's not the case. So really starting with that education piece. And again, that can be all the way up to policymakers, down to kind of the smaller education, sharing with your peers, sharing with your networks, sharing with clinicians, associations, etc. So really everyone has an understanding of the base level of what the scenario is. And then there's more collective action on those pathways to change. So decision making, so work you're doing, if you're doing program work, looking for funding, kind of next steps, using this data to inform that programming that you're doing can be really helpful and important. And to that point, finding, doing reporting and seeking out funding and grants for that programming that you could be developing. The goal here is to have data that's really easily usable, that can just be in your pocket. You can pull out and pull these data points into reports and funding requests that you're doing, to make them a stronger argument, and a lower capacity lift for the organizations that are seeking that information. Okay. Oh, I see. Sam, did you have something from the...
Yeah, Sean responded with access to providers and limited preventive care in response to Annalise's question,
Okay.
which is a
Sean, do
great.
you have more you want to share there of what that's looking like? Is it a workforce issue, or... Sean's maybe not available. Well, if you come back, Sean, I will call on you and have you come off mute and expand more. I see that Nicole's sharing something. Nicole is sharing that for the veteran population that's not able to access benefits through the VA, what is the breakdown of coverage through other means like Medicare, employer benefits? Annalise, you might have exact numbers. The thing is that we don't really know that information. There's not a clearinghouse of collecting that data, and not all of it is publicly available. So one thing that we like to suggest is, if as a state you're looking for kind of different pathways and next steps, and there's a data collection body or mechanism that you have, that can be a really good surveillance piece to put into place to pull together a coalition to get that data. Annalise, did you have anything to add there on that piece?
I wish I did. We've worked with a couple of different states too on going more in depth around Medicaid in particular. Medicare, we don't have any way to access that data unless you all do and you'd like to tell me that secret. I would love to hear from you. So some states, we found that some states collect veteran status. Some states technically have veteran status on their Medicaid forms, but it's rarely used. So what I would add to what Liz mentioned is, yes, there's a clear data gap. Some states are more effective at collecting that data than other states. And I think it's kind of a two-parter. Like, some states are just not collecting it at all, and some states are not collecting it consistently among beneficiaries. But there are lots of other states who are doing cool stuff around Medicaid. Oregon is one of them, where they expanded their Medicaid program to specifically cover veterans. I think that one's a pretty cool program that I would look into if you're interested in the Medicaid process from other states. Florida also has some expansion language. And then I think Liz is going to chat a little bit about Iowa too, which is one of our partners where we did a deep dive and talk about some of the ways that they've looked into meeting the needs of veterans through legislation and policy.
Thanks, Annalise. And I see Sean expanded here too about yes to workforce being the issue. So if there's that that insurance coverage and that access piece, but then there aren't actually the providers who provide the care, or long waits, that's an extrapolation from understanding workforce issues that I'm making, but I know that can sometimes translate there. And then Sean's also saying a mentality of only seeking care if there's a problem. So the other extrapolation I would make there is maybe that's reflective of the piece that we heard from y'all earlier, of that health literacy piece, that oral health care literacy piece, and really understanding the prevention and that preventative care need. I see Leah nodding as well. Do you have anything else to add, Leah?
I will just add that we are facing a lot of workforce shortage issues, especially in our rural areas. And so I do think that lack of access to care paired with that health literacy is likely a pretty large piece of that disconnect.
Great, thank you. Okay, we can head to the next slide. And as Annalise mentioned, we just wanted to share a little bit about our Veteran Oral Health in Iowa report. So this was a piece that really took the idea of the state profile and did a full deep dive analysis. So our research and impact team did a year-long analysis on the state of veteran oral health in Iowa. and in collaboration with our communications team, put it together in, again, a very usable, visually captivating report. And we like to share this as an option of a next step for those states who have a coalition and the interest and the momentum around veteran oral health. We really recommend this as a next step for really doing a true deep dive analysis of what's going on in your state. We can head to the next slide. So part of the work that we did there, we pulled together, we did analysis on those publicly available data sets that we often work within, but we also generated data through stakeholder interviews and really looked at some quantitative combined with qualitative pieces there. And then with that stakeholder work, we're able to develop out strategic recommendations based specifically on different stakeholder groups. So it's actually a very comprehensive, I think there was something, Annalise, I think we said something like 40 strategic recommendations that we made. And then our next step with that, again, working with a community engaged model and really wanting to hear from those local stakeholders and work with them, we've been doing a series of virtual community forums, which we really have an interactive conversation with those local stakeholders about what they're seeing on the ground, what's reflective in the data, and working with them to develop out actionable pathways on those strategic recommendations. So of these many strategic recommendations, what's actually achievable, and what technical assistance can we provide to get there. That's great. Thank you so much for putting that in the chat, Annalise. So some things that we've seen doing this virtual road tour, what we're hearing from states often is, what are other states doing? What are the success stories? What can we do? What are other people doing? So when we're hearing feedback, part of this program is we're gathering that feedback to put together as a compendium at the end of the year after we've gone to as many states as possible of those success stories. But we've also found that people are particularly interested in Iowa and what we've come across there. They have had a lot of success with their trust fund and the way that that funds veteran oral health care. And we've been able to make connections there for states who are looking to pursue that piece and looking at the different ways that they pursued those legislative processes. So we can go to the next slide. Okay, so we are going to dive into some more interactive discussion, and I'm going to hand it over to Sam to do that. And I would just invite, if folks are able to come onto camera for our discussion portion as we get started here, that would be wonderful.
Great, thanks, Liz. Yeah, we'll start with our first question. I just put it in the chat as well. What next steps seem viable for you and your organization to take in advancing veteran oral health?
If I can ask, Amanda, I see the comment that you're putting in the chat around your dental clinic and those compounding health issues. I'm wondering if you might be willing to come off mute and say a little bit more.
Sure. Let me know if you can hear me. I'm sorry, my camera is having issues again. So yes, we run the annual 2-day free clinic in Pittsburgh, the city of Pittsburgh. And so we do see a lot of veterans that come in from even the rural counties and the general population as well. And most of the veterans that we see, you know, they do have issues like high blood pressure. Some are amputees with ongoing issues. And most of them do need full sets of dentures. And that's a really, as you know, complex process and time consuming. So it is really, it's hard because we're not able to, you know, to deliver the resources that they need in just those 2 days, but we get a lot of requests for help. And it's never a one and done treatment. So it's, to your point, Liz, about integrating, you know, the medical health care and these chronic conditions with the dental care. That's where we really see the gap. And that's where, you know, we're hoping to be able to create some programs to provide more resources for full dentures and for comprehensive care. But I hope that answers a little bit of the question, Annalise.
It does, Amanda. And I really appreciate you adding that additional context. if you don't mind, I'm curious about maybe your response to question number 3, which is the additional resources that would help you in your work with veteran oral health. I mean, I'm hearing you say obviously money, like I feel like that would help all of us, is to get more money to provide more services. That feels like, you know, an obvious one, but you also touched a little bit on care integration. I'm hearing maybe even some mental health support. You know, based on your experiences within this population, what additional resources do you think you know, your program, but also other programs that you might partner with to help advance more equitable care?
I think one of the things that we have been looking into is how to partner up with community organizations and social workers and others who have different levels of touch points with our patients. Because again, it comes down to, we can only provide care if we can get these patients to the appointments. And we do have a lot of wonderful volunteers. I mean, we're mainly a volunteer-run organization. We're a very lean team that provides a lot of service. And so we're really keen to find those community partners and those trained social workers and people with these relationships that our veteran patients trust, and they can guide them through the whole treatment process. Because we're very fortunate. I mean, we have to continue to work on funding, but we have been well funded. It's really the clinical workforce, but even when we have that, or we have volunteers, it's getting the patients to those appointments. So I think really our next steps, this is a really helpful webinar, because a lot of the points that you've brought up and the data that's available, we will definitely use that when we're talking with, not only our sponsors and our volunteers, but with community partnerships, so that we can hopefully get this information across. I often hear, yes, care is available through the VA, and that sounds great, but to your points, Liz, we're seeing that a lot of these patients cannot access care. And I actually have a quick question, if that's okay, regarding access. Is there any data surrounding what the most common disqualifiers are for veterans from this care? I'm curious as to why so many of them do not qualify.
You know, Amanda, I think what I'll do, Liz, if that's okay, is actually talk a little bit more about how you're eligible. And I think maybe that kind of gets to that question. So this is all publicly available information. This is not anything that AIDPH has procured in some sort of, unique way. If you go to the VA's website, and the VA actually publishes every year kind of the breakdown in aggregate, not of individual veterans, but the breakdown in aggregate of how many veterans are qualified through disability and the type of disability that they are qualified for to get care. Now, I'm going to put a big asterisk by this, saying it's all pretty confusing. The VA determines eligibility through a series of priority groups, and those priority groups are largely connected to the severity of a veteran's disability. So if you look at the breakdown of who is most likely eligible for dental care, it's not that you are given a disability rating as a result of your oral health care needs. It's most likely that you are given a disability rating that is high enough to automatically give you dental care eligibility. So usually 70%, but 100% disability rating is going to automatically qualify you for dental care. It is not common for you to be eligible for dental care because of the state of your mouth and teeth. That is less common. Most likely you're going to get dental care because of your other disability ratings. And if you look at that breakdown of VA eligibility, I think it's 3% are given a disability rating connected to their mouth and teeth, and that's almost always because of trauma to the mouth. So I know that's a little bit complicated. The long and short of it is, most veterans are eligible for dental care because of their disability rating, not associated with oral health at all. And I'll also just celebrate a little bit here, a little bit of success here, in that we have seen the number of veterans who are eligible for dental care increase over the past couple of years as a result of the PACT Act. So the PACT Act increased disability ratings across the board, and lots of veterans were moved into that 100%, not lots, but more veterans were moved into that 100% disability rating. And now we see it used to be 85% of veterans were not eligible for dental care, and now it's about 80%. So 5% of veterans, because of their increase in disability status, were kind of by default given dental care eligibility. So there's certainly some positive impacts around access as it relates to the PACT Act and increasing access to dental care.
Annalise, a few things. I was going to pop the recent Military Times article in the chat that just came out that there were Annalise and some AIDPH stats were quoted in. And part of that, again, to the point, Military Times is for the military folks. So that education piece on for military personnel about what's available to veterans. And also just a little bit of some cheerleading and celebration along with Annalise of that increase from the PACT Act is why these conversations and this work is so important. And to the point of kind of the nonprofit work, often in these calls, it can feel overwhelming of we're looking at kind of these dire situations on a very large scale, and we're talking about advocacy and policy solutions, and none of them seem just right, or it's not a one size fits all. And what I like to talk about is when we're talking about public health and water safety and kind of the Swiss cheese effect of all the different layers. I like to say that as well. It's not one, or it's kind of all of the pieces together. So just a little cheerleading for if anyone's feeling daunted or overwhelmed by these stats, that it's all those pieces and together. And the more we talk about it, the more we educate, eventually you get to a change like the PACT Act. And that changed a little bit, and we'll keep doing the work, and more change will happen as the incremental steps. And advocacy can feel a little overwhelming, but just a little cheerleading for everyone being here and doing the work. So I'm going to put this news article in the chat as well, and I will get off my soapbox and hand it back to Sam to pull us through some of our other discussion questions. And also just reiterate, if there's other questions that aren't reflected here, please share those as well.
Great. And thank you, Amanda. That was really helpful. I used to work in a rural area as well, and transportation was a huge barrier to access. And I don't know if you have CHWs, but they were really helpful in my area. So I'm hoping that you have them as well. Yeah, so let's move on to our next question. I'll stick it in the chat. Do you have a success story of veteran oral health policy, programming, or advocacy that is happening in Pennsylvania, or even in your area if you're not in Pennsylvania? Any success stories that you can share? Anything that's worked, even on a small scale?
Sam, I'll offer too. I'm curious if maybe today's discussion has sparked any ideas for next steps too, ways that you could leverage some of those data into successes.
Oh, Nicole, sure. Go ahead.
Sorry about that, my emojis got a little out of order. But one thing that I'm kind of curious, and it might relate more to discussion question number 1, but comparing your map where the concentration of Pennsylvanians veterans are located, and looking on the VA website of where clinic locations are located, it doesn't seem like those two things match up, which I think is really a concern. So I am curious to kind of just throw this out into the world and maybe explore a little bit more. Even if we look at our in-network veteran providers, they're still on those outer pieces of the state, let alone where we have actual VA dental clinic sites for those that have access. But I am curious as a possible opportunity to leverage the use of our public health dental hygiene practitioners finding different ways to either partner them with some of our rural health clinics to provide services in these VA settings, or if the VA would consider putting them in some of their primary care locations that might be easier for a rural veteran to access.
I love that idea, Nicole. And I'll also say that what you pointed out is what we've noticed too in other states. So in our Iowa report, it was really the same thing, that those dental clinics are located in urban areas. And so our rural veterans, even those who are eligible for care, just aren't physically located close enough to those dental clinics.
And I will add on to that of what we were actually just talking about this in one of our Iowa community forums. We were talking about strategic recommendations around collective action, and looking at those maps and kind of understanding the overlap or lack of overlap with those pieces can really inform, again, those programmatic decisions or those strategic partnerships your organization's trying to make. To Amanda's point, if you're looking of who to connect with and who to partner with in the community, maybe as transportation organizations or those social workers who have the contact pieces, because you really start to see how you need more and more care management as those barriers build up. If there's lack of a location, and then there's transportation issues, and then maybe also communication issues tied to that. But thinking in a solutions-oriented way, it can give folks an understanding to think outside the box and try to think of what services are already out there, what organizations are providing services, and how could we pull all of those together to kind of solve some of those access problems. Again, is just one part of looking how to increase access within the system that's there. So thank you, Nicole.
Okay, does anybody else have anything to add to any of these questions or any additional questions that you might have? This is your opportunity.
Leah, if you will allow me to call on you, I am curious. I know we had talked about you were seeing and hearing from the coalition an interest in veteran oral health, and I would just love to hear your thoughts on kind of next steps or helpful resources, kind of where you see that interest going.
Yeah, so we had done a stakeholder survey earlier in the year, and the last one we'd done prior to that, I think maybe it was 2 or 3 years before, so it had been some time. And one of the populations that kept popping up that people were really passionate about and wanted to prioritize was the veteran population. And to be fully honest, I haven't thought as specifically of like what initiatives or what programs or what projects can and should come from that. And this has been quite helpful, whether it's what Nicole was talking about in our PhDHPs and connecting them versus bringing all sorts of things. And we do have, even just having this webinar has brought up a lot of conversations or brought up groups that were interested in saying like, hey, we are also trying to prioritize veterans. We don't know yet what that looks like, but we want to partner with that. So we've got a lot of little seeds that are there that don't yet have a full plan or a full vision of what they will look like. But there has been interest in some kind of deep dive similar to the Iowa report, but for Pennsylvania. I think that something like that would be incredibly useful for us.
Thank you. Thank you for letting me put you on the spot a little bit there. I appreciate the contribution. And I really hope you all will keep us updated on kind of what's happening in Pennsylvania and what your next steps are. I see a question from Allison here, Sam.
Oh, sure. Yeah. Allison, for veterans with TRICARE, do we know what percentage also enrolls in dental coverage?
Yeah, that's a great question, Allison. And we don't have that information because TRICARE and the VA are administered separately. The VAJ Veteran Healthcare administration is managed through the Department of the VA, and TRICARE is actually managed through the Department of Defense. I'm a TRICARE beneficiary, so that's where I get all of my healthcare currently. And because there's so many active duty folks there, and then military retirees who qualify for that service, those data are far more difficult to get in terms of who's eligible for dental care and whether or not they have to pay out of pocket for it. And if they're getting it on a base versus out in town, it's kind of complex on the TRICARE side. I haven't been able to access any kind of information. Not even who qualifies for it, none of that on the TRICARE side. So I would offer it's even harder to understand the TRICARE side versus the VA side.
Annalise, I have an anecdotal question for you on that piece. So as a TRICARE beneficiary on an active duty side, our dental insurance is separate, where you have TRICARE and you just don't have to do anything. You have to actively opt into the dental side and then kind of manage it in a completely different way, which to me just kind of reflects that overarching problem we have with oral health of really taking it out of the systematic health piece. Is it the same on the veteran side as well?
I don't believe that we are eligible for dental care, like as a dependent. My husband is as the veteran, but as a dependent, we're not. And we wind up using his works dental insurance for our dental needs. So, and just anecdotally, I have TRICARE Prime, which is the one where we really don't have to pay a lot out of pocket, but we're just a little more limited in who we can access for providers. So, there might be other types of TRICARE insurance packages where you can access something, but I strongly suspect that it costs as much as like a private payer. So in that case, if you're struggling with affording dental care, I would suspect that you're probably still going to struggle on the TRICARE side of things.
Great, thank you, Annalise. Well, we've got a couple minutes left, so I think if there aren't any further questions, I'll hand it back to Liz. And if you have anything, please, you can stick it in the chat or raise a hand. Thanks.
Okay, great, thank you. And we want to close out with this poll. Looking at the following resources, which would you use the most in your work with veteran oral health? And again, this is our piece of wanting to hear from you and understand what is most useful with the data we have as we look forward to upgrading and expanding the tools that we have. So thank you for participating in that. We can head to the next slide as everyone's putting in their answers to that piece. So just talking through what our next steps are, CEUs are available for this session today. We'll be posting the link for those CEUs in the chat. It will also show up as you close out your Zoom. Attached to that CEU request is an evaluation, and evaluations are super helpful to the content we develop and understanding how we can be most useful. So even if you aren't interested in a CEU, please complete that evaluation and let us know what you think. We will post the recordings and resources from today's session on our website, and we'll email those out too. So folks who registered but were maybe unable to make it at the last minute or wanted to share this information with peers and colleagues, will have that recording posted for you all. And again, all of the resources that we were talking about today can be found on vetdentaldata.org. We can head to our next slide. So that closes us out today. I will pause and see if Sam wants to share our final poll information, and then we'll let you all go.
Sure. It looks like we've got 70% participation, 43% educational materials, 43% policy briefs, and also 43% research findings. So we're a split group, 14% for training modules.
Okay, great. Thank you. Well, thank you again, everyone, for being here today and for your interest and dedication in veteran oral health. We hope to hear from you if you have any questions. We'll be sharing out the resources, and I hope everyone has a great rest of the day and a great weekend. Bye, all.